Hello, everyone, and thank you so much for tuning in to Candid Conversations. I'm your host, LaDwania Roberts, and today we have a very special show for you all. We are going to talk about COVID, okay? I know there's a lot of information out there, a lot of misinformation out there, and I just wanted to do my part to bring some facts to the conversation and to the table. I know there are a few people, for some reason, still do not believe that COVID exists. I don't understand why they feel that way, but I wanted to bring someone on the show today who actually experienced having COVID. And I just wanted to hear from her for a little bit about her experience, what that was like, and just to hear another person say, hey, this is real, and be safe out there. So I want to introduce to everyone Talaya Cobb. Talaya, she is an RN out of Washington, D.C. Hey, Talaya.
Hi.
How you feeling?
I'm doing well.
Okay, thank you so much for joining us. So tell us a little bit about your experience. You can tell us a little bit about yourself, where you are, where you're from, what you do, and your experience with COVID and how that all happened with you.
Miss Talaya Cobb. I'm from Washington, D.C., Washington Hospital Center and George Washington University Hospital. While taking care of one of the patients at one of the hospitals, I was told, informed before that the patient had symptoms of COVID, but they were not tested. So we were not sure if the patient was positive or not at the time. And I ended up experiencing symptoms of COVID as well. Was tested the next day and then got results back to say that I was positive. So of course this was in the beginning of COVID, so in March, ended up having to be home for about 16 days by myself. The symptoms I had, of course, was because it was in the beginning of COVID. Some symptoms we knew about, some we did not know about. And then some of the symptoms that they were talking about, I did not have. I didn't lose my sense of taste. I did have the fever, kind of reminded me of the flu in a sense in the beginning. And then start experiencing some symptoms like sensitivity, or some would call it like numbness and tingling, that of course they were not talking about in the beginning. And it was just a little different because of course when you have the flu, it's kind of like symptom management and you kind of go on about your day. Of course it takes some time. This was symptom management, but I just didn't feel myself. So of course I got through it, recouped from it, and then I had to go back and take care of the same patients. So, in the beginning, it was not, for me, I was kind of like, okay, I'm a nurse. I want to go back to work, but I wasn't sure if I wanted to continue to take care of those type of patients, but I did it anyway. Recently, I did do both of the vaccines for Pfizer, which is about 21 days apart. I didn't have any symptoms from the vaccine at all. I've been hearing people say, oh, you get the second vaccine and you start having some of the symptoms of COVID, but I didn't have any symptoms at all.
Okay, great. So you've had the Pfizer vaccine since. So do you know how long you have to wait? So if you're diagnosed with COVID and once you recover, do you know how long you have to wait until you can get the first shot of the vaccine?
I've been told two different things. I've been told that you have to wait anywhere from 60 to 90 days. They don't recommend that you have it before that time frame.
You said 60 to 90 days?
Yes, after having it.
Okay. Okay, got you. Now the numbness you said you were experiencing when you were sick, was it all over your body? Was it just your head?
I had numbness and tingling in my extremities, so my hands and my feet.
Okay. Okay, got you. Do you have any advice for any healthcare professionals out there who are the day-to-day, who's taking care of patients who are sick? Is there anything else they can do to prevent for getting sick other than the PPE? I
think the PPE is one of the biggest things, because that was one of the reasons I believe I did end up getting it, because I didn't have the proper PPE.
Got you, because that was early on. That was early on. Okay, so in your case, I know you can't speak for every hospital, but at Washington Hospital Center, do you guys have enough of the proper PPE you need from day to day?
Yes.
Okay.
Mhm.
Fantastic. Well, thank you so much for sharing your experience. I do know that you have two children. So were anyone else affected by COVID? I mean, I know they were affected because they couldn't be with their mom, for over
Right.
2 weeks.
So during that time frame, neither one of the boys ended up having COVID,
Okay.
um, but they were with their dad. So they still. I found out on a Friday that I had it, and actually they left that same day. So I found out I got tested on Friday, and Saturday
Okay.
morning I found out I was positive. So they stayed
Okay.
with their dad during that whole time frame. And then
Mhm.
when they did come home, and because I am still taking care of patients, it's just preventative measures. When I come home, I know that I need to undress and wash my clothes, and just make sure, of course, that we're keeping the house clean, as well as doing what I need to do to, prevent from, or try my best to prevent from bringing anything home that could,
Right.
potentially cause them to get COVID.
Absolutely. And are your boys in school or are they virtual right
They're virtual.
now? Okay. Okay. Well,
Mhm.
thank you so much for your time and sharing your experience and your knowledge of COVID. We do hope that this thing passes soon, although I don't know if that's going to happen, but all we could do is what we can do, and that's putting on masks, hand sanitizer. Maybe we'll learn something new today, what we could do to
Mhm.
combat this thing. But thank you so much, Talaya. I
No
appreciate
problem.
you. Thanks for talking with
Thank you.
us. Okay. Bye bye.
Bye bye.
Okay, so Dr. Jean-Giles, thank you so much for joining us. Kenecia, thank you so much. So I'll start with Dr. Jean-Giles, if you want to tell us a little bit about yourself,
Mhm.
what you do, where you practice.
All right. So I'm Dr. Jean-Giles. I'm a board certified OBG-YN. I practice in Gwinnett County. That's like Metro Atlanta area. And, in our field, COVID affects everybody. So we've seen quite a few pregnant women um, get infected with the coronavirus. Some more severe than others. But nonetheless, it is a pandemic that we're all dealing with as healthcare professionals.
Okay, thank you for that. And Kenecia, if you could tell us a little bit about yourself, where you practice, and
Yes, my name is Kenecia Mosley. I am a nurse living in Marietta, but my background's a little bit different. I currently work for a medical device company. So prior to that, I worked in cardiovascular memory, but now for the past about 6 years, almost 6 years, I've been working for a medical device company. Um, and even though I work for a medical device company, I'm still in the hospitals. I'm in the hospitals day in, day out, and we travel. So I'm traveling weekly, flying on planes. And in hospitals, we provide bedside monitors and telemetry monitors for the patients. So those are items that are in high demand right now. So we've actually been a lot busier with COVID going on, and kind of seeing the surge that trying to help relieve the surge that the hospitals are experiencing by giving them more monitor beds. So I'm not directly taking care of patients with COVID, but I am in hospitals, having to be on COVID floors, but and just exposed as well. So
okay. Okay. And that's another reason why I had you on today, because I know you travel a lot and I really wanted to get your experience with that. I know I've flown only one time and oh my goodness, it was very terrifying. And what you do dealing with, the actual machinery and all of that good stuff in and out of the hospital. So both of you all are going to bring some fresh new perspectives. I'm sure I'm going to hear something new. The viewers are going to hear something new that can help us along the way. I do want to say what the Chinese revealed early on, and please correct me if I'm wrong because I am not a doctor, but they revealed through autopsy reports of COVID patients that the coronavirus, it obstructs your respiratory system, and like the pathways are filled with like thick mucus that blocks the airways and your lungs. So that's pretty much what we're dealing with, is your respiratory system getting blocked, which is why people need the ventilators to help you breathe. And if they're not getting enough air, if it's too late, then you lose your battle to COVID. So please correct me if I'm wrong in any of that. And you
So
know,
it is a respiratory virus.
okay.
So the flu is also a respiratory virus. Coronavirus, in particular, it attaches to a receptor, and this receptor is found not only in your lungs, but it's found in your gut, in your chest, and so in your brain. So that's one of the reasons why, like, there's a lot of clinical presentations. So symptoms of coronavirus can be headaches, loss of smell and taste. These are all to your brain, right?
Mhm.
You can also have diarrhea, vomiting. That's related to your gut. But ultimately, the thing that does kill patients is what's called acute respiratory distress syndrome, and that's when your lungs are so inflamed that you do go into respiratory failure. So, just a couple of notes. Normal oxygenation percentages for your normal healthy individual is usually like 95 to 100%. Okay. Um, Anything below 92, that's when we start considering it severe. And if you are diagnosed with the actual coronavirus and your oxygenation drops to 92 or less, that is considered severe COVID. And again, like you pointed out, it either goes two ways. Either patients, their body takes over, and with the help of medicine and so forth, they heal up and their oxygenation returns back to normal, or they just continue inflamed, continue not breathing correctly. And what ends up happening is if you can't get the right levels of oxygen to other parts of your body, you'll then have end organ failure. So then your kidneys can fail, your livers can fail, and also your lungs can fail. And that's when people die from coronavirus, is usually related to just the respiratory system failing, thus causing a cascade of events where other organs fail as well.
Mhm.
Wow. Okay. Okay. And because you are an OBGYN, I will have to definitely ask you, have you experienced any of your patients or any of your colleagues' patients um, having COVID? And
Yeah,
have you experienced any of their newborns contracting COVID or being born sick
I have.
with
I
COVID?
have not seen. I've not seen any of my patients with their newborns affected by it. But I have had quite a few patients affected by it. Most of them were mild cases where they were able to stay at home and recover. But I've had, 3 patients in the past year hospitalized um, because they were pregnant and they're hospitalized because their oxygenation dropped because of coronavirus. But luckily, they recovered and they're doing fine.
Okay. So, to your knowledge, you haven't experienced or have heard of a fetus or a newborn baby
Mm-mm.
um, being sick with COVID at the
No.
time of birth. So, I guess you could say if a pregnant woman contracts COVID, it's a good chance if she stays healthy and takes care of herself as best she could, then her baby will be okay.
Yeah, I mean that's generally the thinking. I'm pretty sure it's possible. I'm just saying, speaking for my hospital and my patients, there hasn't been an infant in the ICU sick with coronavirus. But I'm just given the sheer numbers, it's quite within the realm of possibility that it's already happened. But the risk of that baby dying is still relatively low compared to an adult.
Okay. Well, that is great news. That is great news. Not for me personally. I don't plan on having any more children, but I know there's some moms out there who wants to know, who want to know.
Right.
Because you have some people who are actually putting off starting a family or having that second or third child due to
Right.
COVID. So maybe this will help them along with their decision in that. Kenecia, I wanted to ask you with travel. I know when I traveled to Maryland back in September, I had on an N95 mask, then a regular cute mask, probably something like this. And then I had a scarf around my neck. And when I sat down in this guy, I was so upset because I thought the rule was planes were supposed to keep the middle seat clear. And for most of my flights, it was. But my last leg of coming back, this guy sat right in the middle. The flight was full, and I was, extremely nervous to say the least, but I didn't freak out because I had 2 masks on and a face shield. I forgot I had the face shield. I had 2 masks, a face shield, and when the guy sat next to me, I took my scarf that I had for emergency and wrapped that around like my neck and mouth. So I'm sitting there, could barely breathe this whole flight, but I refused, to get sick. And I made it, and thank God I have not had COVID. So that was one way that helped me. I was able to travel with N95, a regular mask, a face shield, and a scarf wrapped around my neck and mouth when, people got too close to me. So that's what I did. Do you have any other, suggestions and helpful tips? Because people are kind of tired of being at home. They want to go on vacation, or they need to see family, or, should we stay put? Should we chance it? If we have to go, what should we do?
Well, like you said, I travel almost weekly and have been traveling since the coronavirus has the outbreak, even during the shutdown, because I still had to go out to hospitals and we had to try to get units up and running to help them out. So when I travel, don't quite go as extreme as far as what you did. I just make sure I wear a mask, a face mask. I'm washing my hands, if I'm touching anything. I fly Delta because right now Delta is the one airline that still is continuing to block middle seats. In the beginning, when I was flying, the planes were just very low as far as the passengers on the plane because of all the shutdowns. So wasn't too concerned at that time because the plane was practically empty. So for the first couple of months while I was out traveling. And then once things started picking back up, fortunately for me, living here in Atlanta, I'm able to fly Delta because the hub is here. But there are, like you mentioned, the other airlines, American and United and most of the other airlines that resumed filling their planes up earlier and where they didn't block the middle seat anymore. Mm-hmm. So for me, I personally choose to fly Delta. My thoughts personally, I think it's safe to fly. I have not been diagnosed with COVID. I have not had any symptoms. No one in my family has. And this is just me, being cognizant of what I'm doing on a plane. I'm not going to be, I'm not talking to anybody else. Nobody's really sitting next to me. I'm not touching things, touching my face. You don't want to touch your face, if you're touching surfaces. And Delta does give you a wipe. So I wipe my area down that I'm sitting in. I keep hand sanitizer on me as well. So that way I'm always washing my hands. So I don't wear gloves. I don't see the need to wear gloves because I'd rather be able to wash my hands multiple times than put gloves on and touch everything and not wash my hands in between touching. So anything else? Let's see. And the other thing, the planes are safe as far as the air filters. Those are probably some of the best filters that you're going to get as far as filtering out any particles with the coronavirus. So I feel safe. And for people who do want to travel, you just want to take extra precautions. And whatever it is you feel that you need to wear as far as PPE to keep yourself safe, whatever gives you peace of mind, maintaining your distance between passengers, or just as you're traveling through the airport. I'm not all in anybody's space, maintaining that 6 foot, that 6 feet between, me and anyone else that I'm around. So just kind of, I think of it as common sense, but that's me because I'm healthcare. So, right. But again, it's whatever's going to keep you safe. And then if you feel like you want to test before you travel, that's also something that people can do. Test before you travel to make sure that you're not infected and what your where your status is before you go anywhere.
Okay. And because you do enter a lot of different hospitals throughout the country, what are some of the protocols? Like when you walk into the hospital, are they automatically taking your temperature? What is that like? Is it like going through the airport where you got to take all your stuff off? You know?
So no, most of the hospitals, pretty much, well, every hospital, I'm going to say every hospital I've been in, and I don't even know how many I've been in, at least probably, I don't know, 15 or 20 in the last year. They all have, most of them will have one main entrance where people can go in and out. So they can monitor people that are coming in. In the beginning, there were no visitors allowed unless it was essential. So you had to have a purpose and a reason for why you were at the hospital. But at the front, at the door, they're monitoring your temperature, asking you all the screening questions. Did you have any symptoms? Have you been diagnosed? Have you been around anyone? Have you traveled outside of the U.S.? Kind of going through all the screening questions. Some hospitals, I have some of my colleagues where some hospitals will make them take the test before they can come on site, because we are on site for at least a week at a time, if not more. And depending on the project, we are in and out of patients' room. We do not go in COVID patient rooms, but that's not to say that another room that we go in, that patient may have COVID, but may not know yet. You never know. Mm-hmm. So some hospitals are a little more strict than others as far as what the policies are, but everyone has been taking temperatures, screening, using the screening questions as well as I go, as I travel around the country.
Okay. And is there like sections of the hospital, like you said, where they keep all the COVID patients? And then of course there's the labor and delivery, and then there's emergency room. So when they say that the hospitals are getting full, is it just those departments or the sections where they have the COVID patients?
So most of the hospitals try to keep those patients in one area or on one floor, and they'll refer to it as their COVID floor. Okay. So if they know the patient has COVID, that would be that floor. So that way people know if you're in that unit, you're taking extra precautions. Now, places like your ED, you don't know, because this is an ED, you're going to have a lot of patients in. So some of those patients may have COVID, some may not. So you just treat everyone as if they have COVID. Okay. But then, yes, on the floors and then the critical care units, what some hospitals will try to do is just have one ICU that will only take the COVID patients. Now, the problem comes, of course, once the beds are full, then you have to start moving it to more than one floor. Mm-hmm. And that has happened. I've had a colleague from the hospital, they were in the ICU. They tried to keep all their COVID patients on one unit, but ended up the whole unit, even the nursing staff, and contracted COVID. And it got to where they ended up having to have multiple floors, ICUs that had COVID patients. Mm-hmm. So they definitely try to contain it, and try to have certain areas where, okay, though that area is restricted, if they know they have COVID patients on the floor.
Okay. Dr. Jean-Giles, and excuse me, because I think I pronounced your name like all kind of crazy in the beginning. Sorry about that. I heard actor Louis Gossett Jr. say he had COVID. He's an older guy, of course. He had COVID. He went to the hospital, and the nursing staff, the doctors, they were just so overwhelmed that they really could not tend to him. And he laid there and was like, you know what? If I continue to lay in this hospital bed, I'm never going to come out. I'm going to die. So he mustered up enough strength and energy to get out of there, called his son. And ever since, he's been okay. With your experience, or in your opinion, when should someone go to the hospital if they know they have COVID? When do you think they should just stay home? I guess, like, what are the signs if you feel like you should go to the hospital, or if you decide to stay home, what do you do? Is there anything you can do at home to, get better, like outside of the vaccine? We haven't gotten to the vaccine yet. But what can you do at home? Should you be drinking tea? Should you be taking vitamins? Should you exercise? Like, what can people do? I know that's like a 3-part question, but if you have COVID and you're sitting at home, what should you do? And if you have COVID, when do you think you should go to the hospital? Like if this happens and this happens, or if you feel X, Y, and Z, go to the hospital.
One reason to go to the hospital would be because you're struggling to breathe, like you're having problems breathing. That's what always drives people to the hospital. Now, if you are at home and you are not feeling well, and then you go get tested and you're positive for COVID, right? What I would recommend is go to CVS or Walgreens or whatever have you and pick up a pulse oximeter. And just you could check yourself at home if you start developing chest tightness and problems breathing. Now, if you're hovering at 95% or more, okay, just monitor yourself at home and see how you feel. Do the normal things. If you're having a fever, take some Tylenol or Motrin. If you're having aches, you could take some medicine to help you with the aches. But the minute you start having problems breathing, I would check your pulse ox. And if it's like at 92 or less, head to the hospital. Okay.
Okay, really quick question. What's the name of that instrument you told people to go
It's
to
a
CVS?
pulse. It's called a pulse oximeter. So it
Pulse
basically,
oximeter.
yeah,
Okay.
it
Okay.
measures your oxygen status. It just clamps onto your finger. It takes your pulse and it'll tell you what you're saturating at. So if you're saturating at 92 or less, you should go to the hospital. But if you don't have a pulse oximeter, most people they should go when they're struggling to breathe. If you're having any problems breathing, head to the hospital. And here's why you should head to the hospital sooner than later. The thing with COVID, there's this phenomenon that occurs, and it's called happy hypoxemia. Meaning hypoxemia is a word for when your oxygen saturation is low. COVID presents like you could be at 88% and you might feel okay, but your body's not equipped to operate that low all the time. So if you just keep hanging around 88, sooner or later it's going to drop, and then your body's going to start getting stressed out, and that's when you get real sick. So you don't want to tough it out and wait. If you have shortness of breath, be ultra aggressive. Go to the hospital, make sure everything is fine, make sure that you are stable. Worst case scenario, you wait 6 hours, 8 hours, and are sent home, but at least you know you're fine, or you may be sent home with some medication and be managed as an outpatient. But I've seen plenty of patients go into the hospital. It turns out they're like at 82, 85%. They didn't realize that they were that low, and they actually got worse in the hospital before they got better. So it is important not to tough it out. If you're struggling to breathe, go to the hospital. But if all you're experiencing is fevers, aches, and chills, and fatigue, that stuff can be managed at home. You don't have to rush to the hospital for that.
Got you. Got you. And if you do get to the point where you need to go to the hospital, would an urgent care center suffice as well, or you need to go to the hospital?
I would go to the hospital. Urgent care is more of like you go there for things that aren't as life threatening.
Got
I wouldn't go to an urgent care if your breathing is compromised, because
you.
again, this is COVID, and just assume that it can get very bad very quickly if you delay any treatment. So
Okay.
go directly to the hospital.
Okay. Talaya, I see you joined us again. I'm glad you did because I have another question for you.
Sure.
Okay. So what I did not ask you is do you or are you experiencing any long-term effects? I forgot it's some weird term they call it, but are you experiencing any
Long hauler.
long
Long
hauler?
hauler.
Yes,
Yeah.
long hauler from COVID.
No, I have not had any long-term or long hauler effects after having COVID. No.
Okay, because I've heard some crazy things, and it's really concerning. It's really concerning.
Well, I would add to that. So that's a good point you brought up, LaDuania. The problem is like, people see the news and they see the stats, right? So right now,
Mhm.
the mortality rate, it's hovering around like 0.3% compared to the flu, which is 0.1. But 0.3% is a lot, and it probably might be higher, but we don't have all that data yet. But nonetheless, there's a 99.7% chance you're going to survive this thing, right? And people look at that and they just take it for granted. But what's not spoken about is that there are a good amount of people who survive it, but they do have these long-term symptoms. I've seen people get it, young, old, healthy, unhealthy. They gotten it, and they're just off. They'll tell you, I have this brain fog. I just don't feel like I'm as sharp as I used to be. Some people will cough for 3 months straight afterwards. Some people will have mood swings afterwards. There are even heart issues that can develop. There are some cases where, because the lung and the heart, they're situated next to each other, and the inflammation that takes place in the lung can affect the heart as well. And what ends up happening around the heart is that there's like a fibrous reaction that occurs, and it's called myocarditis. So you can have like cardiac problems develop afterwards. So you can survive, but there's also the risk of having these effects. So I would just caution everybody that you probably statistically will survive it, especially if you're young and healthy, but that does not mean you won't be without long-term symptoms. So to take it very seriously, for now, look, if you can avoid traveling for now, avoid it, and use your masks. I could tell you that I've taken care of patients with COVID, always with a mask. And I've had patients who we didn't know have COVID. They've come into our office. I've seen them, but we're masked up. They're masked up and I'm masked up. And I never contracted COVID from my patients. I did have COVID, and I contracted it from a family member. So that's where COVID is likely to be transmitted. It's like in close quarters with family members, because most of us are, we let our guard down around our family. Well, that's just my auntie, that's my mom and dad. And that's the bigger picture. So take caution, because what you don't want to do is you don't want to be the one to bring COVID to your elderly grandparents or to your elderly parents at all, and have them have issues or succumb to the disease. So to take it serious, the vaccine is out. We're going to talk about it in a minute, but to take it serious until we can get enough people vaccinated and have this pandemic be over with.
Absolutely, absolutely. So before we talk about the vaccine, I definitely wanted to go over some statistics really quick, because thank God there's a vaccine, and I'm kind of all for it, but I'm on the fence with which brand I want. But so really quick, in Georgia to date, there has been 829,000 cases of COVID, 12,653 deaths in Georgia alone. California, 3.14 million cases, 36,326 deaths. In New York, 1.3 million, 41,530 deaths. So these are the numbers we're dealing with, pretty much 24.9 million in the US. Of course, we know over 400,000 deaths, actually 414,000 deaths to date in the US due to COVID. Now we have a vaccine, we have Pfizer, we have, what's the other one, starts with the M?
Moderna, AstraZeneca, and you have quite a few coming out as well.
Yeah, I don't know why Johnson & Johnson is in the game, but I do like the fact that their vaccine is only 1 shot versus 2. So does anyone want to jump in and, just break it down? The vaccine, is one better than the other, or?
They're all they all do the same thing. So here's the thing with the vaccines. We'll talk about Pfizer and Moderna. They use what's called messenger RNA. So I'm going to break it down as simply put, just imagine the coronavirus, right? It wears a baseball cap, right? So it has its body, it has its genetics, but the signature is that it always has a baseball cap. Just say, I'm from New York, so it has a Yankee cap on, right? What the vaccine does is because mind you, we've been studying coronavirus for years, all right? So this is not new. So it was very easy for the scientists to get the information and the genetic coding for the coronavirus and identify what's called the spike and protein. This is the analogy I'm giving with the baseball cap. The baseball cap or the spike protein is how the virus connects to our cells and infects our cells. So what the scientists did was they isolated the code just for the baseball cap or the spike protein, and that's it. The rest of the virus's genome is left out. So they put that small code. It's just a code. It's like a recipe to make the hat. They put that code in a fat bubble, and that's your vaccine. And so they inject this into us. The fat bubble keeps the messenger RNA, the code for the protein, stable enough until it gets into our cells. Once it's inside our cells, the code is dropped off, and an organelle, it's like an organ inside the cell called a ribosome, transcribes this code. Basically, it takes the recipe, actually makes the protein that's on the surface of the coronavirus. Okay? Then what happens is you have other parts of your cell. They come in, they see this protein, and they're saying, this is not familiar. They break it down, and then they push it to the surface of that cell. And that cell will now express code for the spike and protein, or as we were saying, the baseball cap. Now, you have immune cells that are moving and patrolling throughout your body. They're going to come across this cell that's expressing this broken down protein. And they're going to say, something's off with this cell, and it's going to destroy that cell and eliminate it. And then what ends up happening, the cells that destroyed that cell, they self-replicate, okay? And they keep self-replicating, and they form a memory. So that's what happens. It recognizes the spike in protein as a stranger, and the next time it sees it on site, because these cells kept replicating, is going to destroy anything that has that coding on it. So when the real SARS-CoV-2 or the coronavirus comes into play, your body's already set with these memory cells from your immune system, and they go right to work, so you don't get sick. That's how a vaccine works. Simply put, it's like, this is what the vaccine does. It's like it shows your cells a picture. It says, look, this is a bully, right? We don't like this. Your immune system remembers it, and so when the real bully comes into play, it's already equipped and ready to destroy it. And that's how the vaccine works. So the key word is messenger RNA. This is how it's done. Both Pfizer and Moderna use messenger RNA, right? AstraZeneca uses a slightly different route, but in the end, it's still messenger RNA, and all these vaccines are geared around the spike and protein. And that's how the vaccine works. So the bottom line is they all work the same. They all have the same principles and mechanics to it. They just do maybe just something slightly different, but in the end, the results are pretty much the same. And it's just to get your body to recognize the spike and protein as a foreigner and to build memory cells and immune cells to that spike and protein, so that when the real virus comes on site, it's dead on arrival.
Got you. Okay, got you. I'm clear now. Thank you for that. I appreciate it. I can see it. So, Leigh, I have a question for you. So, if someone was to come into the hospital and say, I want the vaccine, but give me Pfizer. I want Pfizer. I don't want anything else. What do you guys do? Are you able to give, if you have it, you know, can people request which vaccine they want? How does that work? Are you guys having issues with that?
So currently, both hospitals that I'm working at, we're not actually giving it out to the public yet. So they're just still trying to make sure that the healthcare providers have the vaccine first.
Got you. Okay, yes, those frontline workers. Okay,
Yeah.
Okay, got you.
Pretty much at this point, it's just you take what's available. At my hospital, we had Pfizer. That's what was available. Other places, Moderna. But listen, there's one side superior to the other. Both trials showed efficacy of like 94% or greater. And the most important thing was, in both studies, there were 0 cases of severe COVID. That's the one where you get hospitalized. There were 0 cases of severe COVID in the vaccinated group. So it doesn't matter if it's Moderna or Pfizer or AstraZeneca. And I'm pretty sure Johnson & Johnson, their numbers will come out and they'll probably show that they're, efficacious as well. Just whatever's available, it needs to be taken, because the more people we have vaccinated, the sooner this pandemic is over.
Got you. I'm not trying to put out any rumors, but I did hear from a healthcare professional that the coronavirus, the vaccine, I think, what did they say? They've been working on it for a year, right? However, the vaccine isn't new. The vaccine is something that they've been working on for years. It was originally supposed to be a vaccine for AIDS and HIV patients. Do any of you all know anything about that? Is there any truth to that as far as what you know?
It was not a vaccine for HIV patients or whatever have you. Here's the deal. The first coronavirus, we'll call it coronavirus 1, version 1, or SARS-CoV-1, that happened back in the early 2000s in China. And initially they thought that was going to end up being a pandemic, but it was contained. So they had that strain, okay? Then 2011, 12, around there was another coronavirus. And understand, coronavirus is a family of virus, right? And they slightly differ genetically, but they have a lot of common code to them. So you had coronavirus 1, and then you had what's called the Middle Eastern Respiratory Syndrome disease. That was a form of coronavirus, and they thought that was going to be a pandemic, but then it just disappeared.
Okay.
So they were prepared to create vaccines for those. So again, you're talking about genetically, these are similar viruses. And so they've been working on those vaccines for a while. It's just they were able to identify the spike and protein on this one, saw the similarities with the other ones, and that's why this vaccine was made with relative quickness. Okay. So also, look, the reality is medicine is advancing just like cell phones are advancing, okay? I remember the first cell phone was a briefcase, right? Now we have these fancy iPhones, and we can do these meetings, and you could watch TV and do all sorts of things on your phone, right? The technology advances. Well, medicine also is advancing. So the way we make vaccines, the technology allows us, due to our knowledge in mRNA, to make vaccines, not for every disease, but for a lot. So we have more capabilities, and that's just the nature of progression. So people shouldn't be alarmed that it was made this quickly. Normally, we don't, the medical community wants to make sure everything is safe and demands years and years of trials before releasing a vaccine. But this is a global pandemic. It was urgent, and we had, it wasn't a shot in the dark. We had information based on previous coronavirus, and we had previous knowledge from the other coronavirus, and we understand how messenger mRNA works. So this was not done haphazardly. This was done with much thought, given the circumstances, and it's safe. It was done in a safe manner. So it was not for HIV. We already have a library of hundreds of coronavirus. They've been studying them for years. They just took that previous knowledge, as far as knowing the genetic code and being able to isolate certain parts of that code, and they applied it to SARS-CoV-2, which we know as the current coronavirus.
Wow, got you. See, I knew we were going to get some fresh new information today. I'm so excited for that and that actually explains something, because early on, I want to say this was March of 2020, a friend of mine saw on the back of her Clorox wipes that it said something like helps to fight coronavirus. And we were like, what? We all thought this was new, so what you just said makes complete sense. And it makes sense why the vaccine was able to be rolled out, within a few months. So thank you so much for that information. I do want to switch gears really quick before we close out the show today and answer a few questions I have from some of my followers. And either one of you can jump in. Someone asked, what is the best advice you can give to parents who are sending their kids to school? Kenecia?
And a lot of it's going to depend on the age of the child. I'm in here, so I have two kids, they're teenagers, and they are doing distance learning at home, and they chose to do distance learning at home. So from just listening to them, I mean, the capacity is reduced. So the schools have done things to make sure that they have the distance and they're wearing masks, and they have the proper like PPE available to the students. But they were saying in the high schools, like some of the kids aren't listening. They're not wearing their mask like they're supposed to. So they were concerned. So they begged me to stay home instead of doing in-person learning for this semester. And then I have like one of my cousins who has elementary students, and elementary students, from what she was saying, they actually listen. The younger kids listen, and they obey the rules a little bit better than some of the older kids. But if they are going to school, they need to understand the importance of keeping their mask on and wearing their mask. Again, washing hands. I mean, it sounds so simple, but it really is effective in decreasing the spread and transmission of any diseases. And to maintain their distance as well, not to be sharing things like they usually are, like kids typically do. They're sharing, clothes and, gadgets and all kinds of things they do in school now.
Trading snacks and everything. Yeah.
Yes. And they're eating outside, so the schools are taking good precautions. But those would be a couple things that I would be mindful of. And then obviously monitoring your children for symptoms, because if they have symptoms, they need to stay home. There's no need to put them at risk and put anybody else at risk. So, and even if you just doubt it, like if you think that might be a possibility, just stay home. You don't need to take the chance.
Okay. And I want to add too, even before COVID, last school year, I realized that my kids' school, it was rare for them to actually have soap in the bathrooms, and my husband and I, we bought, bulk things of soap and sent it to the school. But then we also made sure our kids had liquid soap. We divided up in little bottles, and, so ask those questions, check in with your kids' schools, make sure they have the soap if, they are in fact going to school, because some of these public schools just do not have the resources, for what the kids need on a day-to-day, like the soap and paper towels and things they need in the bathroom. Yeah. Another question I got, it was another school related. It says, oh, wow. Teachers are dying. What is your recommendation for American schools? Like, what should they do? Because teachers are dying. I see it almost every day on the news, especially right out of Cobb County here in Georgia. But anyone recommendation? Like, if you can talk to, the Board of Education in every state, what should they do?
So I think, this is Dr. Fauci pointed this out. Look, not every county or state is the same, right? Demographics differ, populations differ. So not everybody has the same risks. So I think they just have to, look at each district, look at what the district is doing as far as numbers go, and make a decision. Now, me personally, this is how I feel about it. If you are a parent and you are concerned about whether you should send your kids to school, these are the numbers. Children ages 18 and younger, they're like, for them to pass away from COVID is very, 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 very unlikely. It can happen, but very, very unlikely. No different from the flu, right? So the flu kills children. We don't shut everything down. The same way coronavirus can potentially kill children. However, if you are the parent and you are a high-risk person, and these are what would constitute being high risk. If you have like diabetes, heart disease, lung disease, if you're obese, and if you're older than 65, or you have somebody in the household that's older than 65, then you should probably be concerned about your child going to school and bringing it home. Chances are your child will be fine, but if you fall into one of these high-risk categories, it could become problematic. I'll tell you, my household had coronavirus, right? We got sick. And my aunt, she's the one who got the sickest. She's diabetic, she's 67, and she's obese. She ended up in the hospital for 11 days. They had to give her dexamethasone, remdesivir, Lovenox, antibiotics, and convalescent plasma. And she's fine, but she's still using oxygen, and she's going to recuperate. All right. Every one of us, our symptoms were short-lived. We lost our sense of smell and taste. That probably, in my 10-year-old, that was his main symptom. He just couldn't smell. He felt achy one day, was fine the next, but couldn't smell for like a week or two. So now my aunt brought it to us because she was visiting us. But I would feel terrible if let's say she was living with us and we had sent our kids to school and they came back and brought it home and they gave it to her. That would be, heart-wrenching for me. So for me, my household is pretty much filled with young people who are healthy, and we already had it. So I know the risks. I know it's unlikely, not saying impossible, but unlikely that they'll contract it again. It's okay in my household in particular for my kids to go to school. And it's totally fine to make that decision. But if you are a household where somebody in the household is at risk for having severe COVID, or they fall into that category, I would think twice and just, if digital learning is an option, then do so, even if it's frustrating. Because what's more frustrating is not living. So
absolutely. Yeah.
Decision.
Absolutely. Well, thank you so much for that. And my kids are virtual as well. They have been at home since March 12th. Okay. I play no games. Since March 12th, they've been home. And my youngest just asked the other day, could she go back the last 9 weeks for the spring semester? So it's something we're considering. And like Kenecia, I'm glad you did say the younger kids, they listen more than the high schoolers. And that makes complete sense to me. So thank you all so much with all of the wealth of knowledge you've brought to the conversation today. I absolutely appreciate your time. And I hope that the viewers have learned something new today. Please remember to wear your mask, sanitize your hands. I do like to point out some of my favorite items during the show. So my favorite item for COVID actually is this hand sanitizer, the spray, right? I love the spray. I keep this in my car, like in the middle console with lotion, because all the hand sanitizer we use and washing our hands, you got to have the lotion. So anyway, I keep this spray in my middle console. When I'm finished the gas station, just a couple of sprays like that, wipe it together, lotion, and I'm out. That's all it really takes. Wearing your mask, you know, stay 6 feet apart. Don't travel unless you really have to. But if you do, like Kenecia suggested, fly Delta. Thank you guys so much for tuning in. What'd you say? Uh-huh. Okay.
Just for everybody, because I mean, I've done a lot of talks on social media about the vaccine with other colleagues, and there's a lot of misinformation out there. So I'm just going to break down some common myths about the vaccine.
Okay.
One, it's not going to kill you. It's not, and this is for our community in particular, it's not a form of population control. It's not the mark of the beast, okay, for all you out there. This is not the mark of the beast. It does not have a microchip in it, so they're not going to be able to track you or whatever have you. It does not alter your genetics. Let's just make that abundantly clear. It does not change your genetic code at all. All right, you will still be you. Unfortunately, you will not have superpowers. I wish that was the case, but that's not the case. Your eye color will be the same. Your height will be the same. So let's just get that out.
What about your weight? Am I going to lose, drop 20 pounds with this vaccine?
Unfortunately not. But here's the funny thing. If there was a vaccine that would people a 6-pack, I guarantee they would line up.
Would take it.
I'll take it.
Absolutely. We'll be fighting to get to it.
Right. If there was a vaccine that could change your, some people's eye color, hair length, height, people would take it. Yeah. But there's this mistrust. And I understand there's a lot of history in this country with race and medicine. And, the number one thing people throw up is, what about the Tuskegee experiment? Mm-hmm. This is the Tuskegee experiment. The Tuskegee experiment was at actually diagnosing Black sharecroppers with syphilis and withholding treatment from them just to see how far these would go. And what ended up happening with that is they just lost track of all these people. And that was the Tuskegee experiment. This is not that. This was a trial that's overall 70,000 people were studied. Half of those got the vaccine. And you had white people, Black people, Asians, Hispanics, all in the trial. So we know that there was like 3,000 Black people who were in the trial. They did just fine. There was white people taking the same vaccine. They did just fine. So this is not some, secret operation to destroy Black people. It's a vaccine. And we really, especially in our community, we have to remove this distrust from medicine, because in the end, if you read the news and you watch the news, the people who are affected disproportionately by coronavirus are Black people, and it's multifactorial. It is part of it is systemic racism in the medical institution. Also, part of it is hesitancy from the Black community to actually go seek care. And so this vaccine is something that will help correct that disproportion. And so I urge every one of your followers, if you can get the vaccine, get it. Ask all the questions. You can go on social media, hit me up. You can hit up other doctors, ask everything, make an informed decision. But please don't listen to some just random person who thinks, everything could be cured with herbs, teas, and so forth. There's science actually works, and there's science behind the vaccine, and it works. I have the vaccine. I took it. I'm fine. I didn't mutate. And I think once we get enough people, we can get back to normal living.
Yeah, we are absolutely looking forward to that. And Dr. Jean-Giles, where can we find you on social media since you brought that up? Where can we follow?
You could follow me on Instagram. I usually interact. And then there's a new app, Clubhouse. You could follow me there. And of Clubhouse, me and a bunch of other physicians, we're constantly sharing knowledge and information on various health topics, but the biggest one has been the coronavirus and the vaccine. So we're here to dispel all myths and poor information.
Okay, thank you so much
All right.
for that tidbit of information there, because it's definitely something that we need to know in order to combat this thing. Okay, because I know, like you said, everybody is ready to get back to life as we knew it, and even better. So thank you guys so much. Thank you to Talaya and Kenecia, and thank you to all of the viewers today. We really appreciate you, and hopefully you've learned something new.
Big rims on the leg, won't you come to my side? Come and see how we act, we ride.